What do you call a tiny pill with a big impact?
That's right, we're talking about PrEP.
Yeah.
Hi, welcome to our next PrEPisode on navigation. Today we're talking about the little blue pill that's been changing HIV prevention for queer folk all across this country. Hi, I'm Christopher Hamilton, CEO of Texas Health Action and our program Kind Clinic. Today we're going to be talking about PrEP, and I'm joined by two of our staff members from our Kind Clinic in San Antonio. Why don't you introduce yourselves?
Hi friends, I'm Chris Hernandez. I'm the Testing and Outreach Supervisor for the program in San Antonio, Texas, and I go by all pronouns.
Hey y'all, my name is Antonio Padron. I am the Community Engagement Specialist in San Antonio, Texas. My pronouns are he, him, and I love to make art, dance, music, and create spaces for people who aspire to do those things as well.
Today we're going to talk about PrEP, the little blue pill that's up to 99% effective at preventing HIV acquisition. And we've got some questions that we've heard from people over time. Antonio, do you want to open up your pill bottle and see what question you have for us?
Absolutely. Where did PrEP come from?
Ooh, good question. The first PrEP that was ever made was Truvada. And actually Truvada was the first combination drug that was approved for HIV treatment. And I remember back in the day, I don't want to say how many days ago, because that's a while ago, but back in the day, it was so revolutionary to have two drugs in one pill, and how life-changing that was for people living with HIV to have to take fewer pills. And over time, some researchers got this idea of what if we use this for prevention? What if we could take a pill once a day and that actually prevented HIV acquisition? So there were some research studies done, and it showed that when you took that pill once daily, it was up to 99% effective at preventing HIV acquisition. This is game-changing. This is the first time we ever actually had a tool like this, and that was back in 2012. That the FDA approved Truvada for pre-exposure prophylaxis. That's the fancy medical word that means prevention.
So what was like your first reaction when PrEP was first introduced? And like, you know, how do you view it as it changed the HIV epidemic?
I was stunned, honestly, because I used to work in HIV services in the early 2000s, and like I said, you know, we knew Truvada for HIV care, but not for prevention. And when I heard there was this pill that you could take once a day, that was just like, my brain didn't understand this at the time. I also entered a monogamous relationship with my now husband, and that was 2009. We didn't have PrEP at that time. Like, we barely had iPhones at that time. Like, that was only 2 years old, and apps were brand new. Like, Grindr was just coming out. So, like, the world that we live in now is so different than that period of time. And I never actually got to use PrEP during the time it would have been right for me. And so I have friends now that engage with PrEP and use PrEP and have different lives. And I'm really excited for them for this, because sex for pleasure is something that we should all be able to take advantage of if we want to, right? So I think it's been just revolutionary for people to be able to feel differently in their relationship with sex.
That's awesome. Thank you for sharing. I think it's pretty insightful that you got to see that shift and change to like access, and not just access, but seeing sexual health and wellness opportunity for growth. Like you saw it, you know, go from unavailable to available. So
it was really incredible. In Austin, that was the first time I saw this. There were bus ads that said, "Get the pill that prevents HIV." And it just, everybody in Austin was like, what is this? What are you talking about? Even news covered it, like in their fact check section. I'm like, yeah, this is for real.
Christopher, I do have a question. How did the discovery of PrEP lead to the origins of Kind Clinic?
Yeah. So PrEP started in 2012, or was approved in 2012, right? Actually, this year, 2025, is our 10-year anniversary of Kind Clinic and Texas Health Action. Well, there's a couple years in between there, right? Between 2012 and 2015. PrEP wasn't really being prescribed a lot in Austin or various parts of the state, really, because providers weren't comfortable having conversations about sex or gay sex with their patients, and so PrEP just wasn't being prescribed. And so that's how Kind Clinic started. Actually, it started as Austin PrEP Access Project, a way to navigate patients to prescribers that navigators knew about that might prescribe, but there weren't enough. And so that's how Kind Clinic started, was the recognition that, you know what, we need a space for LGBTQI plus people to access PrEP where we are experts in that, where we're not going to judge or shame anybody in whatever sex they like to have or talk about with their provider. And that's how it all started. All right, second question. How does PrEP work?
So PrEP works by blocking the HIV virus from replicating in the body, preventing it from establishing an infection. So the way you do so is by being consistent with your daily regimen, taking that pill every day and adhering to it. So there's really not a whole lot to PrEP, but adherence. Adherence is going to be key in prevention.
What is Kind Clinic doing to reassure folks that taking PrEP is okay to take and regarding their health, and people who fear side effects from medication?
So routine testing. When you are enrolled in PrEP, you do get tested once every 3 months. And part of those tests, it's not just for STIs, but they do blood work to make sure that your body remains healthy, that the medication is doing what it's supposed to do in prevention. No, there are so many speculations about PrEP. I've had patients even share that they've had weird dreams on it. I'm like, boo, that ain't PrEP. That's your subconscious, okay? But the key takeaway from it is that it is prevention. If you're going to go out rollerblading or riding a bike, you are going to want to wear knee pads. You're going to want to wear a helmet to prevent any accidents from happening, especially if you love riding your bike. And I always make that analogy with people who have a healthy sexual lifestyle. If you love sex, why not get your knee pads and helmet in the form of PrEP?
What if I'm concerned about other medications I may be taking? Are there any problems with that? Should I just talk to my provider about it?
I would suggest talking to your provider. They're the ones that are going to basically give you, they have the final say so. Is this medication right for you? There are 2 forms of PrEP. So there is Descovy and Truvada. So either medication, they'll see which one benefits your health most.
Have you heard from patients how they feel differently after taking PrEP for a while? Has that changed their relationship with sex?
Yes. So I do have plenty of patients that have shared that they feel a little more liberated.
Yeah.
They feel free, and they feel like they own their sexual lifestyle. Sex is more than just a physical engagement, right? You also have the mentality of it. When you go and get tested, you have the anxiety behind it of like, oh my God, what is my status? What is my status? Without PrEP alleviates that. So it's more than just a factor of assisting you physically, but it's something that's also going to help you mentally.
Who of us couldn't do with a little more liberation?
Mm-hmm. And that's right. You ready, friend?
Yes, let's go.
Okay. All right, let's see what's behind bottle number 2. Who is PrEP for?
PrEP is for anyone who is sexually active or HIV negative. It is not limited to anybody. You can take it if you are men-seeking man, trans, non-binary, or assigned female at birth. Taking PrEP doesn't make you promiscuous. It is just a tool to be used for your liberation in any sexual activity that you partake in your personal life. And it's a solid safety measure for people who want to practice safe sex.
Are there some misconceptions about it? And I know y'all live in San Antonio, I live in Austin, and you know that every city in this state is different from all the others. So what do you hear in San Antonio about PrEP?
Well, I'll go first. I definitely want to touch base on infidelity. People that are in monogamous relationships typically struggle with PrEP. And I say that because we do get clients that come and get tested together. And there's always the scenario of my partner wants to continue PrEP, but we're monogamous, so I feel like they are susceptible to cheating. And it's one of those things where, once again, here's a negative connotation with PrEP, and we need to change that that language of susceptible to cheating versus, hey, we still want to be safe. We want to continue that prevention rate. Also, outing. So we do have a lot of fear of, we do have people that are still in their journey of not being open with their sexual orientation. So they sometimes feel that, oh my God, if my mom or auntie, abuela, whoever it is, finds my PrEP bottle, they're going to know my sexual orientation. When in all reality, as Antonio mentioned, it's for everybody, and anybody's walk of life can benefit from PrEP. But those are the fears that are also triggered by stigma.
I imagine sometimes there's probably mixed status couples, maybe somebody's living with HIV and just not able to get that viral suppression, and may just be difficult, and maybe PrEP is right in that situation. Is that also available for people?
Absolutely, yes. Especially when we do have a new diagnosis situation, we do like to gauge that individual while they're in care. Hey, how is your partner? Are we able to provide services for that partner as well? And in the event that a partner is negative while the person is getting into HIV care, we definitely want to offer PrEP, just to safeguard the status and of that individual as well, while we're also caring for the individual living with HIV.
Another common misconception with PrEP is the access, and people being afraid or thinking that they don't have the coverage regarding insurance, right? And I think it's important for people who are looking to take PrEP to, be reassured, or to be assured, that they are able, if you have insurance, or if you don't have insurance, we have measures that we can take where we can assist you in being able to take PrEP.
There's also the misconception that I'm glad you pointed out that PrEP is for everybody, because a lot of times cisgendered women do not know that PrEP is something that they are able to attain as well. It's always associated as a gay thing. It's not just a gay thing. It really is for everybody that is having sex. And come on, we all are having sex, right?
Mm-hmm. Even when PrEP started, there was a number of people that started to slut shame and talk about that. And I don't know, are we still doing that? Is that still a problem we have to talk about? Does that still happen?
It does still happen. Even people coming just to get tested, there's still a stigma there. Some of the feedback I hear is, I want PrEP, but everybody's going to think I'm a slut. Or, I want PrEP, but I'm never going to find love, because people are automatically going to tie that to, I'm just out in the streets. And it's like, that's not necessarily what it is. There are plenty of people out there that take PrEP who aren't even having sex, but they are safeguarding themselves for in the event that they do have an exposure. You don't got to get ready if you stay ready, right?
Yeah.
All right, I'm sold. So I've got one last question for you. I know this is going to be a real surprise. How do I get on PrEP with Kind Clinic?
That's a really good question. So you can attain PrEP by visiting us at one of our walk-in centers. We do have locations in San Antonio, Dallas, and Austin. So you would come in and get tested for HIV and STIs, and then the tester will book you an appointment there. So what's really unique about Kind Clinic is that we offer virtual services, so you don't necessarily have to do your follow-ups or appointments in the clinic. You can do it from the comfort of your own home. And then also attaining the medication. You don't have to necessarily come to the clinic. We can send the RX to you or at a pharmacy of your choice. Or you can also call our patient support service center. They can also book you an appointment over the phone.
And I imagine we can get all that information at kindclinic.org, so we don't have to write down or memorize a phone number right now.
Absolutely, because there's a big old button there that says access to PrEP.
Awesome. Thank you so much for joining us from San Antonio. I really enjoyed this conversation, and I hope that more people learn about PrEP if they didn't know about it before.
Awesome. Thank you for having us.